So the background for our study is that we've done some previous study where we could see that opioid use were frequent among elderly with dementia, and more so than in elderly without dementia. And you could also see that opioid use had been increasing. We know from the generally that opioids are associated with severe side effects and have been associated with an increased mortality risk in the general population, but we don't know if that's the case in elderly with dementia. And we therefore wanted to investigate if opioids were associated with an excess mortality risk in elderly with dementia. And therefore, we conducted a cohort study based on the Danish registries, and we included all patients diagnosed with dementia from 2008 to 2018. And we selected a group of patients who had not been exposed to an opioid in the year prior to their diagnosis. And then we looked at a group of patients who were exposed to an opioid after they'd been diagnosed with dementia, and a group who hadn't been exposed to an opioid. And we followed them for 180 days or until they had an event such as death. And overall, we included a little more than 31,000 elderly who received a prescription for an opioid, and we matched those to individuals each. So a little more than 63,000 individuals with dementia who did not receive an opioid prescription. And we found that among those diagnosed with dementia, 42% redeemed their opioid prescription. And among those exposed, when we looked at mortality, we found that 33% died within the 180 days after they retrieved their first opioid prescription, whereas only 6% of those who did not redeem an opioid prescriptions. When we go in and adjust for differences in the groups, such as age and gender, and comorbidity, nursing home status, whether or not they've been hospitalized within the past month, and drug use, we found that there was a fourfold increased mortality risk for the 180 days among those who were exposed to opioids. When we look at different types of opioids, what we found was that strong opioids were associated with a higher risk than weak opioids. And it's particularly fentanyl, the transdermal formulation of fentanyl, were associated with an eightfold increased mortality risk in elderly with dementia. So that's sort of the results. And overall, what we can conclude is that opioids are associated with overall a fourfold excess mortality risk, and particularly transdermal fentanyl is associated with the highest risk. And these results clearly shows that opioids are associated with a significant risk in elderly with dementia. And this is something that, as a physician, if you consider initiating an opioid for a patient with dementia, you need to have this in mind. And this needs careful discussion with both the patient and caregiver. You need to discuss risk and benefits when considering opioid therapy. The CDC's recent guideline from 2022, they actually say that all other options should be explored before you consider opioid use. And I would say this is even more important when you're dealing with patients with dementia, because they seem to be at a greater risk. When I compare, I didn't do a comparison with elderly without dementia, but when I compare to other results from other studies looking into risk of opioid use, they found around an hazard ratio of 1.7 and minus average 4. So it seems that they might be at a greater risk than the sort of general population. And therefore, it's even more important to have this in mind and be consider very carefully if this will benefit the patient and what the harms are.